歡迎大家出。
Welcome to the press briefing. We have today Dr. Chuang Suk Kwan, Head Center for Health Protection, and Dr. Larry Lee, Chief Manager of the Hospital Authority. Dr. Chuang will first give you an update on confirmed cases. Yes, last night rather, there are tested positive 26 cases from case number 13126 to 131511. One is an imported case, 25 are local cases. Of those, 10 cases are related to the Yat Kwai House case. 8 are either residents there, 8 cases are residents or people who have stayed in the block as family members of residents there. And then there are 2 cases in Ying Kwai House. These are residents there. One is a cleaner at Yat Kwai House, and the other lives on the same floor of the cleaner in Ying Kwai House. Is a child. It's 13126, 13128, 13129, 13130, 13131, 13133, 13134, 13143, and 13127, and 13145. And then there are 5 cases related to the Buddhist Fat Host College. There are 3 2B in class 2B1 and also in class 4B, class 4-3, and class 3C. Case number 13135, 137, 138, 139, and 140. And then there is a case of a family member of a teacher of Dahlia Memorial School 13142, and then that's the Delta cluster 13088, family member of a previous case, and also 13136 and 13144, who are family members of case number 13088, of the Delta strain. And then there's also a student in a primary school in Lei Chang Oak 13148. Now, this case is in a different class than the other patient. They've had no contact. The last day of school was the 12th of January, and the case was identified in repeated test. And then there are 2 family members of 13079. That's case 13149. At block 1 of Caribbean Host, and then a family member of case 13097. That's case number 13158. Also in Caribbean Coast, but in another tower. And then there's a case who went to Little Balls in Causeway Bay on the 11th of January together with 13120. This is case 13150. They went shopping and then they had meal together. And then there's a case not traceable, 13132, 40-year-old male living in Lam Chung Street. He works in a construction site. The Poly University's genome sequencing found that he has the same genomic sequence as the case of 13045, so there could be some transmission there, but we need to look further into the case. And there's another case not yet traceable. It's a 81-year-old female. It's a suspected Omicron case. She's retired and she lives with her family in Fukang House, Taiwan House. She's had 3 doses of CoronaVac. On the 18th of January, she had a fever. She went to a private doctor, and then she went to the accident and emergency ward. The CT value is 17, and she went to the A&E ward on the 20th of January. She usually just moves around near her neighborhood, just like going to the wet market, and she might just say hi to security guards, but there's no other contact. There's another case in Taiwan Estate who lives at Yat Kwai House, but then that patient is in security guard at Taiwan House Estate. And there's another case 13147 with a traceable source is a suspected Delta case. The patient lives with family members in Lam Pig House of Lam Tin Estate, and there's no history of exposure to pet shops. There's the security guard on the 10th floor of the Cheung Sha Wan government health offices working at the Labour Department, and the lunch is usually nearby, and that patient just goes to and from work. And then we have collected environmental samples. There are some positive cases. For example, the lift buttons on the 8th floor in the lobby, and then on the 7th floor in the refuse chamber on the door handle inside. So it should just be cleaners who would go inside the refuse chamber. And for that case, we've collected a positive environmental sample. We're still doing analysis for other samples, but it shows that there is a large, extensive scope of contamination in Yat Kwai House. And we have over 100 positive preliminary cases. Most of them are residents of Yat Kwai House. If you count the preliminary positive cases and the positive cases together, there are 96 residents or visitors in Yat Kwai House who are either confirmed or preliminary positive cases. And then, as you know, we have confirmed cases involving security guards working there. There's also the cleaner who lives at Ying Kwai House but works at Yat Kwai House. And then there's another cleaner living at Hill Kwai House. Now, for the Yat Kwai House cluster, there's a case who works at elderly home on the 3rd floor of the podium of Kwai Chung Estate. Now, last day of work was the 20th of January, but she started feeling well on the 19th, and then she went for a test on the 21st. The result was negative. Is a 49-year-old male. He takes care of about 50 elderly residents. There are over 100 residents in the elderly home, but he is only responsible for taking care of about 50 elderly residents. And if he is a confirmed case, then these residents will have to be quarantined at AWE. There should be places there. And this person also works at the Tek Cheung elderly home in Tek Cheung building. He helps out there, but he has no contact with the elderly residents. He is only responsible for distributing medication in the dispensary. So for those working in the dispensary, but anyway, people there will have to be tested. Now, so we have 2 confirmed cases in Ying Kwai House, and on top of that, we have another 5 living in Ying Kwai House who are preliminary positive cases. And there are also another 6, or rather the 6th case, Princess Margaret Hospital Authority confirmed to us that this is a person working there. So we are in the meeting with the hospital authority. So my colleague of the authority will give you more details. So in total, there are 8 confirmed or positive preliminary cases in Ying Kwai House. Among the preliminary positive cases, I have information on 1 or 2 cases that I could give to you now. One case is an 18-year-old female student studying at the Dahlia Memorial School in Cat Lei Lane, not Broadway, and she lives in Tai Wo Hao Estate, a Futek house. So we are following up on the case further. There's another case, a 61-year-old female. She lives at High Street, Sai Ying Pun. She's a retiree. And we have checked her movements. On the 17th of January, she went to a shop, a restaurant in Ming Sing, called Ming Sing. She went there, and then we found that there's a previous case, 13073, a case linked to Little Boss at around the same time. this patient was also having a meal there at the same restaurant where this lady went. So we're trying to check if there's a link. Dr. Lee, please.
As of 9 a.m. this morning, reported 49 cases, 27 patients have been discharged. Altogether, 1,241 patients have been discharged. As of 9 a.m. this morning, there are 330 patients who are in North Lantau Hospital, Hong Kong Infection Control Center, AWE, and 2 public hospitals under the Hospital Authority, and all patients are in stable condition. There is a service assistant in Princess Margaret Hospital with preliminary positive results. On January 20th, she started having a sore throat, and on the 21st, she had more pain in her throat, and then she went to Yan Chai Hospital A&E ward on that day, and it was found preliminary positive. This colleague lives in Ying Kwai House in Unit 1803. She took days off on January 15th and 16th, and she went to work on the 17th to the 21st. She assists the nurses, and she was wearing masks the whole time. On the evening of January 20th, she chatted with a colleague who worked in the obstetrics and maternity ward in the pantry. She wasn't wearing a mask at that time, but her colleague was wearing one. But I believe that the first colleague infected the second one, and she is actually 1 out of 8 of close contacts. And the second one who got infected is now a preliminary positive, and for the other colleagues who are waiting for their results. So the maternity ward are now not taking any new patients and are going to sterilize and cleanse the entire ward. And we have taken about 32 environmental samples and have come back all negative. The hospital authority has already reported to the communicable disease branch, and 20 patients in hospital have already undergone tests and have found negative. And for the other 20 odd patients, the situation will be followed up. There are 33 colleagues are deemed as close contacts. 9 of them are already negative, and the others are all pending results. We now move on to Q&A session. Please identify your organization before you ask your questions. The gentleman in the back. Good afternoon, TVB. I'd like to ask about the arrangement for the home quarantine in Yat Kwai House. And this morning, I saw that many of them are lining up downstairs for testing. But actually, would that increase the rate of infection? We have seen more confirmed cases in Yat Kwai House and Ying Kwai House. Is there actually a high spike of infection rate for those residents? Should residents keep their windows closed and turn off their exhaust fan? Well, so it seems that the quarantine arrangements are for 5 days, but now that with more confirmed cases, would you need to extend this quarantine period? There are other housing estates near Yat Kwai House and Ying Kwai House, and they share communal facilities. So should they not take transportation? And yesterday, residents were banned from going out from 6 p.m. in the evening. Are there still people who haven't returned to their residences? Do you think that there's already a community outspread, and are we going to see astronomical figures in the infection rate? Are we able to, or do we have the capability to actually take care of all these arrangements? All the departments are working very hard. In this arrangement, and of course we hope that residents will pay attention to the U-trap to ensure that water will be poured in on a frequent basis so that it will not become too dry. And they should also keep their windows closed if the U-trap near the pipes are too dry. I know that the Secretary of Health will hold another press briefing and she can keep you up to date on the details later. It's not very easy for us to control the spread because we cannot trace all the whereabouts, and it's infecting people from all walks of life, including those elderly who are living in aged homes. Many of them are still not yet vaccinated, and we are afraid that they would become infected. So everyone should pay attention to their personal hygiene, to keep their hands clean, and to avoid gatherings. I hope that we will all work hard together to fight off the outbreak. Dr. Lee. Can you repeat the question? I'm sorry, the speaker is off mic. Well, we can't really predict the number of cases. We can't forecast the number. We focus most of the cases in the North Atlanta Hospital, Hong Kong Infection Control Center, and in the Asia World Expo. So altogether, we have about 2,000 hospital beds, and we are continuing with adding more capacity. The lady in the second row. I'm from Now TV. The 2-year-old girl from Ying Kwai House and the cleaners genome sequencing, have you compared that they are the same? Do you think that they are linked cases? Are the family members of the 2-year-old girl confirmed as well? It seems that there is also a confirmed case in an elderly home. So for the other workers, do they have to be sent to quarantine as well, or do you have to wait for them to be tested positive? Do you think there would be a high risk of infection in elderly homes? And some staff in the hospitals took off their masks while chatting with others. Do you think there's also a high risk of infection within the hospitals? Did the assistant help patients, or how many newborns did she take care of? There's a 61-year-old retiree who lives in Sai Ying Pun and who has been to this seafood restaurant. So is there also a high risk of infection, or do you think that this restaurant should need to be closed down, the Star Seafood restaurant? This girl who lives in Ying Kwai House is considered a close contact and would be sent to quarantine. We haven't compared the genetic sequencing yet. I know that Polly Yu is now working on the genome sequencing, and most of the Kwai Chung cases have similar sequencing with the 13045 case. For the nurse who works in the elderly home, this person is not in direct contact with patients. This person will just distribute medicine to other nurses to give to patients. But since they work in the same space, all those who work in that area would need to be quarantined. So only the elderly who live in that ward would need to be tested. For the other elderly home, the worker is a part-time, and this person mainly works in the pharmacy. So there's also no direct contact with the elderly. We believe that the risk is low, and so people will only need to undergo testing. Of course, other arrangements will be made if there are really confirmed cases. For those who enjoyed a meal between 12 p.m. to 2 p.m. on January 17th should go for testing. I'm sure they would have received a notification on the Leave Home Safe app. So for those who still haven't gone for testing, please do so as soon as possible. This restaurant will cease operation for the time being, and all workers would need to be tested. And then we would take a look at the floor plan to see whether other customers need to be tested.
About the staff member, now she works at the ward before delivery, so she doesn't come in contact with infants. And of course, we have our protective gear, and we have reference standards to follow. That's why we have not listed any patients as close contact. As for the place where members, employees rest, or whether they chat to each other and so on, we will be amending our guidelines. A gentleman over there. I'm from cable TV. Now, for if that's the case of Yat Kwai House, and then for Ying Kwai House, do you need to lock down Ying Kwai House as well? And then some residents actually went to work. Is it really desirable? So is it just a matter of time that there will be a major outbreak in Hong Kong? Now, for the employee of Princess Margaret, how many pregnant women did she come into contact with, and is there a need for compulsory testing? Now, Yat Kwai House, well, we have a lockdown, but would there be a lockdown for Ying Kwai House? We'll see. Later on, there will be a press conference. Perhaps we'll wait for or the press release of the secretary. Now, for Omicron, is really hard to control it because most people don't have symptoms, and even if they have symptoms, they are like those for flu, so people just overlook that. And we found in some cases when there are symptoms people just went to see the doctor or took a test, and then the result was positive. So that's why we appeal to people to be alert. We don't have much of a seasonal flu now, so if you suffer symptoms like flu, it's more likely it's COVID rather than a flu. So that's why if you're not well, please go and take a test. And you've been to high-risk places, take a test. Now, because the incubation period is short, so by the time we find out, maybe the disease has been passed on to family members and others. So that's why please be alert. And if you don't feel well, go and see a doctor or take a test. And and try to avoid unnecessary activities. Now, for the patient assistant, when she's working, she was wearing a mask, and so that's why there are no patients listed as close contacts. But then there's mention of 50 patients listed as other contacts. There are now 20 of them in hospitals. They've been tested and results are negative. And for the other 32 patients, they've been referred to the Center for Health Protection. Well, let's take an English question. The gentleman over there.
Hi, I'm TMHK. So what do you think was the major reason for this large outbreak in the Kwai Chung estate, according to the latest assessment? And is there any further risks for the residents to continue staying in their homes right now, given the large outbreak? And how would you assess the risk of this outbreak spreading into other blocks in the estate? And do you have an estimate number of the residents who are living in the two blocks but who have not yet tested? And how will the government follow up on these cases? And also, you talked about a preliminary positive case who works at 2 elderly care homes. How would you assess the risk of the workers spreading the virus to the elderly people? Thank you.
From the environmental samples, we looked at the lift lobby, the buttons, and also the refuse collection button, the disposal inlet handle. They are tested positive. So the first one, maybe we cannot say anything because everybody may press the button. For the refuse disposal inlet handle, the only people who may work inside are the cleaners. So it is possible some of the cleaners are infected. In fact, we did find some cleaners infected. So as they will walk along each floor and to clean and to collect the rubbish, so then this may contribute to the spread of the illness. Of course, other residents in the block, once they infected, they can also infect other people in the whole blocks. So this may add to the other further spread in the blocks. So once we found that the cleaners may have maybe one of the factors that may help to spread the illness, we have quarantined all the cleaners in the Kwai Chung, that amounts to around 44 cleaners. So far, we are still tracing some of them and we'll put them under quarantine. And I think the number of cases is expected to increase because there will be an incubation period for this illness. So once we try to stop try to quarantine and isolate all the cases, we hope that the case numbers will drop. But and I do not have figures that residents not yet tested, but we do know the resident list in Hong Kong. I mean, in those buildings. So I also note that some of the residents, they were not tested during the night, during the phone call. When we during the night when the RTD, but they were working while that was carrying on, or they stay outside. So, but some of them did get tested because they developed symptoms. So I urge them to go back to the building and get tested as soon as possible.
Next, over there, please.
The staff of that elderly home, she worked as dispensing medications, but she usually do not have to directly provide personal care for individual elderlies. But for prudence sake, of course, we consider those elderlies are at risk because of Omicron, of the high infectivity of Omicron, and also I believe many of the elderlies, they are not vaccinated. So we will transfer them and put them under quarantine for close observation.
Over there, please, on the third row. Yes, I'm from Ming Pao. I'd like to follow up on the Kwai Chung estate case. For the cleaner who lives and works in Yat Kwai House and Ying Kwai House, would she also go to other blocks for cleaning work? Now, it's said that case 13064 had some contact with her. How long was it for? And were there other cleaners or employees there at the same time? Are they confirmed cases or are they preliminary positive cases? As for Ying Kwai houses, these cases on different units and floors, or what is the distribution? And for the Hill Kwai house, the cleaner there, where she's been to do cleaning work, and was she in contact? Did she have any contact with the Yat Kwai house case? And then for the elderly home staff, where does she live or how did she become infected? For Kwai Chung estate, how many of the preliminary positive cases are related to Kwai Chung estate? So that's my question.
嗰位清潔工喺
The cleaner lives in Ying Kwai House and works in Yat Kwai House and mainly cleans in Yat Kwai House. For the cleaner who lives in Hill Kwai House, I do not know yet which buildings he or she cleans. So for the person who cleans in Yin Kwai house, she did not remember having contact with other people in that building. Today there are around 10 confirmed cases. I don't recall the number exactly for yesterday, but then added with the preliminary positive and the already confirmed cases, there are 96 residents and visitors to that building. There are also some who work there, and there are also cases from Yin Kwai house. So we're talking about 100 cases here, and I do not have information on other individual cases yet. The worker at the elderly home lives in Yin Kwai house. So we're talking about 73 units involved. There are more cases in the lower floors, but then actually quite some cases in the upper floors as well. You see cases in almost every floor. Oh, the plan for Yin Kwai house. Currently on the 14th floor, there are 4 units affected. There's 18th floor and 25th floor and 28th floor. Next, the lady in the back.
CMP. First question is, are there any structural or pipe issues with other blocks in Kwai Chung Estate, which may explain why there's such a large outbreak there? Or is it possible there's more than one super spreader in the blocks? Second question is about the investigation at Dragon Place Restaurant in Aberdeen. Are there any updates on that, as well as the Meifu cases involving the kindergarten teacher and the 2 students? And third, I'd just like to ask if the prelim elderly home worker is vaccinated, and is he or she suspected to carry the Omicron variant? Thanks.
You mean the registered nurse?
The
Elderly home worker?
Yeah.
He's a nurse. So he's vaccinated with 2 doses of BioNTech. And for the Donghui Chantang, the restaurant in Aberdeen, we did a visit yesterday and found out that the 2 tables are very far apart. Actually, they are in separate rooms with the, they are separated by one whole room. So they have walls from bottom to top for the 2 cases. We're still investigating about their toilet route because seemingly they are not from using the same toilet, but we need to check in detail. Yeah. For the Meifu kindergarten teacher, we do not have further updates. But of course, we review all the dates of the octopus and the in and out of the students, and they are very close together in a few days. Not only on 14th, also on previous 1 or 2 days. So the time for them to go in and go out, they are very close together. Yeah. And what else?
Are there any structural or pipe issues with other blocks in the state, which may explain the large outbreak? And is it possible there's more than one super?
I think Omicron is highly infectious. So I'm not sure about the super spreader thing because the incubation period of Omicron is very short. So is it due to one person or due to many persons and amplify the spread? It's difficult to know at this moment. I understand there's no major structural problem in Yak Kwai Lao. Yeah, I think the other blocks may be similar.
How
Next question, please. If there are no other questions, we end our press briefing today. Thank you.
Let's see.